Hello and welcome. Today we're diving into a rare and devastating neurological disease called Subacute Sclerosing Panencephalitis, or SSP. This video will explore its causes, how it affects the brain, who is most at risk, and what can be done about it. Prepare for a detailed look at this complex condition. SSP is almost exclusively caused by a persistent measles virus infection. It's crucial to understand that this isn't just a regular measles infection. Instead, it's a mutated form of the measles virus that evades the body's normal immune defenses and remains hidden within the brain. While widespread measles vaccination has drastically reduced cases, understanding the etiology is still important. The persistent measles virus within the brain triggers a slow, progressive inflammatory response. The virus infects brain cells, primarily neurons and oligodendrocytes, leading to their destruction and gradual demyelination. Demyelination is the loss of the myelin sheath, the protective covering around nerve fibers, disrupting nerve signal transmission. This widespread damage causes the neurological symptoms characteristic of SPE. SSP is extremely rare. It's estimated to affect about 1 in 100,000 people who contract measles, particularly those who get measles before the age of 2. The latency period, the time between the initial measles infection and the onset of SSP symptoms, can range from several months to even years. The incidence has significantly decreased due to effective measles vaccination programs worldwide. Understanding the epidemiology helps guide vaccination strategies. The symptoms of SSP are progressive and devastating. Initially, subtle changes in personality, behavior, and intellectual abilities might be noticed. As the disease progresses, motor problems emerge, including myoclonic jerks, which are sudden, involuntary muscle contractions. These jerks are often rhythmic and repetitive. Eventually, individuals experience seizures, muscle rigidity, vision loss, and cognitive decline, ultimately leading to a vegetative state. Diagnosing SSP involves a combination of clinical evaluation and laboratory tests. The typical clinical presentation, including the characteristic myoclonic jerks and progressive neurological decline, is often suggestive. An electroencephalogram, or EEG, reveals a distinctive periodic pattern of brain activity. Elevated measles antibody levels in the cerebrospinal fluid, obtained through a spinal tap, and in the blood serum are also key diagnostic indicators. Brain imaging, such as MRI, can show characteristic white matter abnormalities. While there aren't distinct subtypes or classifications of SPE in the traditional sense, the disease progression can vary. Some individuals experience a more rapid decline, while others have a slower, more insidious course. The age of onset and the overall health of the individual can also influence the disease's trajectory. Unfortunately, there's no cure for SSP. Treatment focuses on managing symptoms and attempting to slow the disease's progression. Antiviral medications, such as isoprinosine and interferon, have been used in an attempt to reduce viral load and improve immune function, but their effectiveness is limited and results vary. Anti-seizure medications are used to control seizures. Supportive care, including physical therapy, occupational therapy, and speech therapy, aims to maximize the individual's comfort and function. Nutritional support is also essential. The most effective way to prevent SSPE is through widespread measles vaccination. The MMR vaccine, which protects against measles, mumps, and rubella, is highly effective and safe. Achieving and maintaining high vaccination rates within the population is crucial to preventing measles outbreaks and, consequently, reducing the risk of SPE. Vaccination not only protects individuals but also contributes to herd immunity, safeguarding those who cannot be vaccinated. The prognosis for individuals with SSPE is unfortunately very poor. The disease is almost always fatal, typically within 1 to 3 years of diagnosis, although some individuals may survive longer. Recent research is focused on developing more effective antiviral therapies and exploring immunomodulatory approaches to boost the body's immune response against the persistent measles virus. Gene therapy is also being investigated as a potential future treatment strategy. While significant challenges remain, ongoing research offers hope for improved outcomes in the future.